afternoon, everyone. Good afternoon, everyone. My name is Mary Kate Haver. I am the medical librarian at the Biomedical Library at Moffitt Cancer Center. I'd like to take this opportunity to thank and welcome Dr. Peter Cannon, the program coordinator for the University of South Florida School of Information's Responsive Librarianship Lab, and Dr. Natalie Green, an assistant professor at the program coordinator for the School of Information's Master's Library Science and Information program at the University of South Florida. Denise Sheriff is a senior instructor at the USF School of Information. Unfortunately, she isn't able to be with us today. We are very much looking forward to Dr. Cannon and Dr. Green's presentations. When you're ready, I'll actually stop sharing now and we can start. Dr. Cannon?
Yes, great. All right. Hi, everyone. I am going to attempt to share my screen. And let's see if we can do this. Let's see correctly. All right. And if I can go ahead and do the slideshow, play from start. There we go. I hope everyone can see that. Great.
All right. I think we're ready to go. Hi, everyone. As mentioned, my name is Dr. Natalie Green-Taylor, and I'm an associate professor at the University of South Florida. And I'm here today with Dr. Cannon, to talk about our Responsive Librarianship program. So you can see our not succinct at all title here, Addressing Community Mental Health Information Needs Through Customized Reading and Programming. Go ahead. Yeah, so I just want to do just a brief outline of what our presentation is going to cover today. And hopefully, we're going to get through a lot of the content fairly quickly so that we can have a lot of time for discussion and questions at the end. We'll do this brief introduction of our team, what we do, what responsive librarianship is. We'll talk about the social work and library competencies and how we see them as overlapping and mapping together. We'll talk a little bit about the Story Strong program, which is one of the applications of responsive librarianship we're working on right now. And that's at 3 public library systems in the Tampa Bay region that we are implementing that. So we'll talk briefly about what that programming looks like. I'm going to talk just briefly about our social work intern that we have had working on the project over the past year and what she does, what she adds to the project. And then finally, Peter will cover a little bit about how you might make it work in your library, what some of the suggested partnerships we have, and things like that. So you can see here our team. We have several graduate assistants who have been working with us on this project. So I just want to mention Brittany, Erin, Katie, and Janet, and then also Kiara, who is, as I mentioned, our social work intern. And they've all been really integral to the program and to the project. So want to make sure that they get their due. And I think that's the basic introduction of what we'll be talking about today. I think that now maybe the most important thing is for us to introduce the concept of responsive librarianship, and Peter's going to do that.
Right. I know I'm not supposed to read definitions from the screen, but I'm going to go ahead and do that this time because I think when you look at the definition and we talk about the definition, everything kind of plugs in because we did kind of work on this. We're trying to define this concept for quite some time. So it is the delivery of personalized library services. That's important. Responsive librarianship is not personalized down so much to the patron level, but we're talking about our target population. So they are personalized in that respect. And it's in response to a need or a problem. And so in that way, we theme it. We theme our programs to make sure that we're addressing, sometimes I like to call it an exigence or a problem or a need that a particular population within a library's community needs to be addressed. And we're looking for a modification of the reader's situation. This is a change. What we're not looking to do is to cure people, overnight or anything. This is a therapeutic program, but it's not therapy. And I think that's one of the important distinctions that we need to make to a lot of librarians from the beginning. So I'm going to go ahead and go to the next slide here. So these are just some of the major points that responsive librarianship brings to the table. So responsive librarianship is ecological, and this is the definition of what an ecology is. But what we do is we don't just look at a librarian, or we don't just use a book. We use this large network of people, places, and things that are connected to a library community. So when we talk about distributing agency, we're looking for change over time. And so it's, if you think about just a regular ecology, tidal pool or something like that, it's constantly changing. It's never the same. And the ecology changes depending on the need that you're trying to address. And then we go to the second one, it's designed for specific health ecology. We didn't design this and then, try and force it onto a target population. What we do is we take a look at the needs of a particular target population, and then we design the program around it. And when we talk about our partner libraries, we'll see that we have 3 very different programs coming out of this framework. So when we talk about addressing the specific needs of the participants, again, we're looking at mental health or emotional needs. If we're talking about teen population, a lot of it is just developmental, or it could be dealing with the effects of bullying, or family issues or friends. So I'm going to go ahead and admit this person here, I think. Oh, maybe I can't. Sorry about that. So when we talk about the specific needs of the participants, again, it's themed and it's focusing. And that brings us to the 4th one. This is focused on discourse. This is a talking program, for lack of a better term. But that's, social workers, we're talking about talking therapy. Again, this is not therapy, but it's about discourse and how we communicate among ourselves. And it's interdisciplinary, data-driven, and evidence-based. And that is very important for many reasons. One, for trying to explain this program to your community stakeholders, but also in trying to make sure that there's some sort of sustainability if you're trying to obtain funding, grants, or anything like that. So I'm going to move to the next slide. And so how is responsive librarianship different from bibliotherapy? We have moved away from the term of bibliotherapy because we focus on different things and do it slightly different. Now, the traditional term is bibliotherapy, and bibliotherapy is reading for a specific therapeutic use, focusing on text or audiobooks or something like that. Again, bibliotherapy tends to be more text-centered, and it's not very personalized, and it's very prescriptive, as we have up there. Whereas responsive librarianship focuses on everything that libraries do in programming, services, finding these community-based resources, including the text. So in the old days, if you were doing bibliotherapy, someone said, oh, you need to read this book because it's about a similar situation you're in. We've moved beyond that to something that is broader, yet more helpful. So what we've done is we've eschewed this one size fits all. And that's the idea, is that it's personalized and flexible depending on the needs of your community. And how is it different from Reader's Advisory? Reader's Advisory is great. Everyone loves that, right? But what we're trying to do is we're looking to address a specific need or problem in a target population. And we're looking to improve emotional or mental health outcomes, whereas Reader's Advisory could serve many different uses. And Reader's Advisory is basically a model for just delivering books. Ours is a framework for delivering personalized library services to meet a problem. So those are going to be your major differences between responsive librarianship and Reader's Advisory. Let's see.
I think this is me again. Thanks, Peter. So that was an excellent overview, I think, of the framework that's underlying this practical project that I mentioned earlier, that we're working with these 3 library systems, public library systems. So this is a grant. It's funded by LSTA, and we'll have a whole spiel on that specific funding where that comes from at the end of this. There's a slide devoted to that, but just to mention that is, where the money is coming from for this. But in this project that we're doing, we focus on 3 specific interventions. So one is to develop and distribute 24 evidence-based reading lists. And we have developed these reading lists through a combination of data-driven process of collection development that it relies on traditional methods. So that might be, getting recommendations from our partner librarians. That might be, reading lists that have been developed by other organizations, both medical and library oriented. But then we've also employed a mixed methods approach, which uses AI-driven text analysis. And Peter did a lot of work on this in his dissertation for his PhD. So if you have questions about that in particular, we can go into that a little bit more in depth in the question and answer session. But the idea is that these reading lists are put out by our partner librarians. They are distributed to, any patron who wants to read them, but that, this is just one component of this program that we're running, and it's supported by reading group sessions and instructional programs. And you'll note that, as Peter kind of said, this is not a noted departure from what public libraries do all the time. They offer reading groups, they offer instructional programs, they offer reading suggestions, but it's this combination of these 3 interventions and then how they work together that we're really hoping to emphasize the nature of responsive librarianship. And just to get a little bit more specific, so each month we've committed to running this for 8 months at these 3 different partner library systems. And each month has a different theme at each library. And those have been developed in conjunction and in partnership with our partner librarians that specifically target segments of the library population in those areas. And within that theme, there are 2 reading group sessions at each library online for each library system each month, and 2 instructional programs. And just as an example, we've done things like on financial literacy. And for that particular session, we had a tax expert come in and do an instructional program. But then that was also supplemented by reading group sessions of books that related to either financial literacy or financial happiness, that kind of thing. And again, the themes don't necessarily have to be, the topics don't necessarily have to be the same in each session, but they all operate under this larger thematic grouping that we've come up with for that month for that particular population.
Next slide.
Yeah. And then the further, so I said that there's 3 interventions, but the 4th kind of component to this is the social work component. And that's something that we thought was really important to bring in because, there's a lot of overlap, as you know, between social work and librarianship. And in particular, what we're trying to do to make sure that we're expanding access and community support to people beyond just library programming. So we brought that in response to a need for 4 barriers that people have to getting help. And you can see here, they're identified here: access to psychiatric services, inadequate discharge planning for people when they leave either inpatient services or any kind of like hospital situation, lack of transportation services, and a lack of positive community social support. supports. So we primarily focus on that fourth, the social supports, trying to connect people to resources that they have in their community. But we also are trying to also integrate what we're doing with what social workers are doing as well. And our program delivery at Temple Terrace and South Holiday, which is part of our Pasco system, we integrate services that are offered through the grant with mental health services by fieldwork students through the USF College of Social Work. And that's that intern that I mentioned before. So she comes in and she attends the sessions, and I'll talk a little bit more about her role in the particular sessions as we move on in the presentation. And I see that we do have a slide or a question before I move on to the next slide. We'll be sharing more information on the actual topics. We can, that's something we can definitely cover in the Q&A. And eventually, once we're done with all of this, we're hoping to make a lot of the lesson plans that we've done for each of these sessions, the reading lists, all of that available through an actual targeted training program that we're working on developing. But we can definitely talk a little bit more in detail about what we've covered when we get to the Q&A. So yes. In the meantime, though, I just want to mention that we've done some specific mapping with the ALA core competencies and the Council on Social Work education competencies. And we put that is in the graphic here, which I think does a nice job. Denise actually did most of the work on this, but she did a nice job setting up how much overlap there is between the fields of librarianship and social work and what we're trying to accomplish, the goals at least. A lot of this information came from the ACRL EBSS Social Work Committee. And they focus on the National Association of Social Workers Code of Ethics and the Council on Social Work Education Competencies, which is what the latter is what we focused on here and how they align with the perspective of the ALA core competencies of librarianship. So you can see, both disciplines focus on ethical and professional conduct and an emphasis on human rights and social justice.
Let's see, lost my, here we go. Cursor wants to run away. Oh, okay, here we go. So I'm going to talk about our three partner libraries here individually to show you that we have different populations with different needs. So the first one on the screen here is Temple Terrace Public Library. We have wonderful librarians working with us on all three, but working specifically with the teen librarian here. And so the Temple Terrace focuses on using graphic novels. So our first intervention, this list, this evidence-based list is, this was a collaborative effort between our program, the Responsive Librarianship Lab, and the Temple Terrace Public Library to create this list and to create these themes. So we can see here, we've got an instructional session that we did about othering. What does it feel like to be an other? And we used Coraline as, this was kind of the base text. We had a book club discussion. And then Temple Terrace is a little different because we don't necessarily use community-based resources or experts to talk about things. What we do is we do crafts or other activities tied to the other two interventions. So the intervention with the book list, and then we have a book club. So what we did is we met, we talked about Coraline's book, but it wasn't just what you would consider both, book clubs to be, talking about the characters or what happened. Our book club discussions are targeted towards our theme, which was othering. And then what we did is we made a craft, which was a two-dimensional fabric or a paper doll. Mine came out terrible, it was horrifying, which fit the theme of Coraline, I guess. But it was the idea was like to create you. Who are you? Can you create how you, perceive yourself and how you're perceived by others? And then the other text that we did was El Defo, and this was a wonderful book. If anyone hasn't read it, you should. It's sweet. It's very long for a graphic novel too, but this was again talking about othering and having to overcome challenges and so forth. So that's our Temple Terrace Public Library because we're dealing with teens, and Temple Terrace is, a little above average when it comes to the demographics and economic issues facing a lot of Florida libraries, but there's a, the librarians know their teen population, and there's a lot of food and housing insecurity, and just dealing with teen issues, developmental issues, and so forth. So that was our Temple Terrace population. Hillsborough County, very different from Temple Terrace. Temple Terrace, even though it's partners with Hillsborough County, and in Hillsborough County it is a single library. Hillsborough County, however, is a large, library system, and so there are many branches. So we don't deal with one individual branch. We deal with specific programs within HCPLC, which is basically their book clubs. And so the same thing, Hillsborough County, we have book lists, these evidence-based book lists, which are published on their their website. And then we do book clubs. And then what Hillsborough County did, which was fascinating, is they had a series of speakers that they wanted to present, but trying to figure out how to do it. And so this gave Hillsborough County and us an opportunity to collaborate in theming. And so what Hillsborough County did is, for our third intervention, which is our community-based resources and experts, they were the ones responsible for lining those people up and bringing them in. Again, because of the COVID restrictions, all of this up to now has been online. So this has been just, a wonderful opportunity. So again, we did an instructional session. Everyone should have heard about the Midnight Library, pros and cons. But it was important for us because we talked about different issues, relationships and family, not just mental health, because, Midnight Library does talk a lot about mental health. But there are a lot of adjacent issues in each book. And that's one of the other things that's important about the difference between responsive librarianship and bibliotherapy. These books do not have to be right on point. Again, a lot of these issues are adjacent. So there are issues dealing with relationships and families in the Midnight Library, as well as, the idea of mental health. And so, we did these book sessions, and, people talked about some of these issues related, and, using the Midnight Library as a prompt, and it worked really well. And then our third library partner is Pasco County, and they kind of fit in between Temple Terrace and Hillsborough County. And we were, our target was adult women and men who are basically disenfranchised from the political and social system. And so they're not so much families, but usually individuals trying to make their way, again, dealing with food insecurity, housing insecurity, underemployed or unemployed, people dealing with emotional or mental health concerns. We don't like to call them problems. Those are concerns or issues. So for example, we did a journaling activity, and this was related to anxious people. But anxious people isn't necessarily about anxiety. It's about the stories that were weaved together by Frederick Bachman in his book, and having to deal with a very challenging situation. And again, so we had our intervention, our book club, we had the journaling activity, and then we brought in community experts. And one of our more popular community resources were yoga instructors. And we, the yoga instructor just goes through, does a little background of yoga, and then goes through mindfulness and yoga exercises that you can do anywhere. They didn't require a studio or a large amount of space. So again, I guess the most important thing to walk away from this is that we had one basic framework with these three interventions, including also our social work intern. But all three programs, I think Dr. Taylor can back us up on this, is that all three are different because the program is designed to be flexible.
Yeah, and before I get into the social work integration, I just want to circle back to that question about what the themes were. I was pulling up as Peter was talking, what our themes that we covered. And, it's interesting because is some overlap between the three libraries, but the implementation of how, what books we've chosen for these book clubs, what the specific instructional sessions were are very different. And that has depended on the audience. But just in addition to the examples that Peter just gave, so for the Temple Terrace, so for the young adult audience, some of the other topics we mentioned othering, outsider status. We did family as one of our topics, mental health, EDI, so equity, diversity, and inclusion. We're covering quarantine right now. Relationships will be our August theme, and then we're going to cover bullying in September. At the Pasco system, we're covering, which again, as a reminder, is more specifically focused on adults. We cover things like economic insecurity, anxiety, financial literacy, loss, career education development, digital literacy and empowerment, families and relationships, and then health and wellness. And then finally at Saunders, which again, like Peter mentioned, just was more focused for families. We also included things, so several similar topics to South Holiday. So things like economic insecurity, anxiety, financial literacy, et cetera, et cetera. But then the books specifically were chosen for those. We tried to include a children's book for one of the two book club sessions that was focused on that topic. And then the instructional sessions were completely different because, again, these are different communities. They're targeting, they have different resources in their geographic region. And they're targeting, people for different reasons. So hopefully that gives you, some idea, a little bit more expanded version of what Peter was just saying in terms of examples. But that fourth element that I was talking about, the social work integration, that was, has been really, I think, kind of unique to our program. And we've had a really nice opportunity having this social work student participate in the program. As I mentioned, her name is Kiara. But she's done a number of different things to supplement the programs that we've been running. She creates resource lists for the themes and topics of the book club and instructional sessions. She's conducted basic community and environmental scans of the library locations. And then I briefly mentioned that training program that we are starting to work on, implementing many of the lessons and things that we've learned over the course of this project. She's done a number of things about building out a specific training program for social workers. So training that social work students or, in the field, that they could take this eventually once it's developed a training module to learn a little bit more about what librarians are doing and how they might bring these principles of librarianship into their own practice. And one of the things, next slide, Peter.
Trying to find mine. There we go.
One of the things that she, talks about is we do Kiara checks at the program she's able to attend. So that's where she is able to give a personal voice to resources that people might want to check out. She makes sure that, people can, know that they can feel heard, that, she's available via our email address to respond to people if they have questions. And then she also, if we have questions, if things come up in the conversations, she's able to apply some of her social work training in the specific language the social workers are able to use when we're actually implementing the instructional sessions and reading groups. So that's been important and something that, if you have access to social workers in your organization, I think it's promising that it's been such a kind of a seamless transition or seamless integration, I should say, to having her involved in the project.
Next slide.
Yep.
Okay. Let's see. Oh, this is me, right? So how do you make it work at your library? One of the things I like to do is tell everyone, tell librarians, is that we don't really do anything different than other librarians. You do this already. You have reading groups, you have book lists, you have community resources. People come in and they give, talks or speak, or, they have some sort of exchange within, this library space. So for us, finding these partnerships is important, but a lot of the work has already been done depending on your target, the needs of your target population. Again, this is ecological thinking. And it's just a different way of thinking about how to deliver library services. So first of all, schools of social work bachelor or master's programs. I think our Kiara started out as a bachelor, and now she's a master's. And so she's progressed through her program, and we were lucky to have her involved. So if you're near a university, they're always looking for some sort of placement for their students. Or you may, if you're like Pasco, originally Pasco, before the COVID restrictions, Pasco has a social worker employed by the county. And so you may have someone who's interested in this. A lot of libraries have social workers in the library, but they're still doing that traditional social work practice. What's different is this is a true collaboration all the way from beginning with the book lists to finding resources and all through each of the intervention. So also look for state or county government departments. There's a lot of resources out there. There's no need to duplicate if it's already been done. Department of Elder Affairs, Children and Families, Department of Health. You don't necessarily need to find speakers from each one, but they are really good for resources to provide to your participants. And then there's nonprofit organizations, United Way, Salvation Army, Catholic Charities. And these all are, they target specific populations. We have to remember that when we get to cultural competency. So for example, one that's not on here is that there's a military cultural competency in discussing issues that, affect vets, unemployed or homeless vets. You have to have that competency. We don't in the program, but we know enough to reach out to these organizations that do have that cultural competency. And so finding partnerships is important in dealing with these target populations. And then future directions, again, we're looking to do this for 8 months. This actually started off at two different libraries, two different libraries in restrictive environments, one in a residential drug treatment center, and then another in a crisis care center for pediatric patients. And so what we've done here is we've taken it from very small populations, 88 in the adult, and I think 25 at the most in the pediatric center, and expanded it to a more general population. And now what we're looking to do, again, is to implement this training program to train other librarians and libraries on how to do this. And again, we're not doing anything different. We're just theming everything and using the resources of the library's ecology to solve a problem that our populations have. And so, so that's where we plan to go in the future, is really focus on the idea of training other librarians and other library systems on how to do this. You don't need money. You don't need a lot of money to do this. If you have a small collection, you don't need to go out and buy a lot of books. You don't need to hire staff members. You don't need to pay people to do this, again, because it's a flexible framework that's designed to work in your community. Again, all three of our programs that we offer to the public are different. There's not a cookie cutter, program like the old bibliotherapy system was. So let's see. I think, is that it, Natalie? Let's see. Yes.
I think that's it. I think it's just our contact information, the very lengthy website. We're working on getting that updated a little bit more. And then I think that last slide might just be the paying the bills, how
Oh,
we
yeah, we have to make
closing
sure
it.
that.
So we should just throw that up there just so,
Oh, let's see.
oh,
There you go.
there
There
it
we
is. Yeah, just that this was funded under the provisions of the LSTA from the IMLS. And I won't read all the numbers to you, but you can see here that's where our funding came from. I also just wanted to mention, because we didn't specifically talk about it in the project, but Peter emphasized that this is evidence-based, right? And that we've tried to add that as a central component because I know how important it is to so many libraries now to justify the programming that they're running and the books that they're buying, collection development, that sort of thing. And so I just wanted to mention that, a few of the ways that we are tracking that. I mean, some of it is simple numbers, attendance. That has been a little bit challenging in the age of COVID. We've moved it all online, and, getting people to show up at a specific time is not always easy. But one of the things, we've started recording some of our sessions that don't have active participants. Obviously, for privacy reasons, we don't like to record those. But the ones that don't have active participants, we put those up on a YouTube channel, and so we're able to track hits and things to that. But we also send out a survey at the end of every session. We are able to work with our librarians. We are anticipating getting circulation numbers on the books that we recommend to see if those have changed at all. So there's a number of different ways you can do it without interfering with, getting into, we're trying to change behavior. We're not actually studying the patrons at all, but we are studying how the collection has been impacted, how attendance at programming has been impacted, and things of that nature. So that's just something that we didn't specifically call out when we were describing the program, but that is something that I think is pretty central to responsive librarianship. So I wanted to highlight. But with that, I think, other than that, I think now we just want to open it up to questions.
I'm going
And
to stop sharing this, I guess, or should I not?
Actually, this is Mary Kate. It's fine if you leave it there. Actually, there's two questions from Susan in the chat. The most recent one is that she'd be interested in more information about possibly implementing this. Do you all work with libraries? Are you interested or available to work with libraries to develop this type of project within their center?
Yeah, absolutely. I know, so Peter's done some specific training with Cephalin and is working with, is it Miami? I don't know.
So Cephalin and Miami-Dade, they had kind of this joint training. And so we did do that. And so that's one of the things that we don't own this. We're not, not copywriting or anything like that. We're definitely out, here to help libraries do this.
Okay. So as like consultants and say, well, I've done this, or, I'm interested in doing this,
I mean, I think
how do I get started?
Yeah, I think the best thing to do right now, it would be to just contact us via email, and we can share some of our resources and things like that, answer specific questions. Because again, it's going to depend so much on your specific library. I mean, that is the goal of this training program, is that it will be kind of a step-by-step. What is this? How you might justify it to your admin or your board? How it might influence the way you design programming, the way you do your collection development, how it might guide readers advisory and things like that. So, I mean, that's the ultimate goal. And one of the things we've talked to some libraries who are interested in implementing it as we're working on that is that maybe they could even work with us on that, in developing the training program, maybe work through some of the iterations as we're developing the training, and to see if it's helpful, give us some feedback on what they need more of or what's not useful and that kind of stuff. So, I mean, I think right now, currently, the best thing to do would be just to email Peter or I or Denise, or really anybody on this list can get it to the rest of the group. And we can give you specific information for your case. But that is, the ultimate goal is that hopefully we'll be able to make a lot of this more specific, because I mean, we have, 96, I think, lesson plans and instructional plans that we've developed for this project. And, the goal is that hopefully we can share those, I mean, they may not be directly applicable to your situation. I would not recommend just taking them and just running them as they are, because they've been designed for a very specific audience. But we didn't, a lot of ours, we've used other people's ideas to develop those lesson plans, and obviously give credit to that. But none of this is, there's no reason to reinvent the wheel, like if the work's already been done. So.
And Susan had also asked about more information about, actually, she's interested in volunteering to help establish training. So that's good.
Okay, great. Awesome.
Also about some examples of additional actual topics that you've all addressed that, you briefly mentioned through the presentation about, addressing financial literacy. Are there any other specific topics?
Yeah. So I think I read through that one list, and I probably read it too fast. I have a tendency to talk pretty fast, but I can kind of just touch on it again. So some of the topics at the Temple Terrace, so this was with the young adults population. We talked about othering, being an outsider, so both in space and place, and kind of embodied outsiderness. We talked about family, mental health, equity, diversity, and inclusion. Right now, we're actually focusing on quarantine, kind of coming out of quarantine, how it impacted your last year, which has been sort of interesting, because some of the youth the youth participants, they didn't seem to be as impacted as I thought that they would be. I mean, we have a very small sample size, but I think it's been kind of it's just been interesting to get their feedback on that topic. We're going to talk about relationships in August and bullying in September. And then it's South Holiday, which is the specific branch we were working with through Pasco, and Hillsborough. They share many of the same topics. So things like anxiety, financial literacy, loss, career education development, digital literacy and empowerment, families and relationships, and health and wellness. But the way that those topics have been implemented at those two libraries, library systems, have been different. With Pasco, we focus more on an adult population. So, the instructional sessions we've had that have been very focused on, for example, with career education and development, how you set up an Indeed profile, for example. And then at Hillsborough, it's focused more on families. So in that sense, like the reading group sessions have been balanced. We chose for each month one adult focused book, and then one book that was targeted more to children or youth. And so the topics are kind of the same, but that's a really great example of how flexible they can be, and how it does depend on who your audience is, and also what your partner library, or your own library, if you're in a library, your existing resources, your existing partnerships, and what kind of programming you're interested in running. How those different topics can look.
And I just want to add the other thing that kind of this umbrella, when I talked about it being discourse based, we're looking at empathetic thinking. There's different ways to do this, but our focus is on empathy and identifying and building empathetic thinking, not only empathy about others, but about yourself. And the idea is that we're activating what we call theory of mind processing. So when we pull titles in books, we're looking for either passages or questions that talk about, people's real lived experiences in relation to empathetic thinking. Frankly, that's what we need. And so a lot of these issues, we frame them in this, we call it heuristic, looking through this empathy lens, if you have empathy glasses. And so that's what's common to all these three, systems that we have: Temple Terrace, Pasco, and Hillsborough County.
I just saw a question about using the social work student interns and consultant type positions. Yeah, so I wish Denise was here. She deserves a lot of credit for getting this set up and running. I think it was actually quite a bit of work at the beginning to try to work with the School of Social Work, make sure Kiara, as she was working with us, at least initially, was doing this as one of her field studies. So, we had to work within the confines of what the school required for the paperwork and her overall semester project, making sure that she was getting her hours. This is kind of a different project than what a lot of the traditional social work internships look like. There's, the micro hours of working one-on-one with different individuals was not as present. I think in that sense, we were a little bit fortunate, and I hate to say fortunate in terms of COVID, but I know a lot of their students were struggling with that element just because so many of the internships had to go online. So they were willing to be a little bit more flexible with us up front with how she was, working with individuals. But that said, she, one of the requirements was that she did have a social worker as kind of her point of contact that could consult with her and give her ideas for resources if she had questions that came up. That person was able to answer. And in that sense, we were lucky. We were able to work with it was Pasco County, right, Peter, that Lisa's,
Yep.
associated with. She's their
Pasco County Health. She's their social
yeah.
worker.
Okay. Couldn't remember what her exact title was. But yeah, she was able to come in and consult. She actually even offered, she was able to do one of the instructional sessions for us for one of our events. So we were able to work with her, but I think that's something that it would depend on how strict the school that you were working with is, and whether or not this was kind of a volunteer position the student was interested in working on, or whether it was a formal internship field study class that they were doing. And, that would be kind of something to navigate, I think, in whatever situation you were working within. But she's been wonderful. And I think one of the funny things is I don't think she realized, she's told us like she didn't realize how much overlap there was between what she was learning and what librarians are doing. So I think it's a really wonderful opportunity to just start that dialogue about all the the important community resources and social support that libraries offer to a whole other field of study. And conversely, I think we've been really fortunate. One of the things that we're emphasizing in the training is listening. And we do, I think, a lot of training in library schools on telling people things, on getting knowledge out there, on providing information, which is obviously important. But I think one of the things that this project and hearing about her social work training has helped me remember is that so much of that instruction is based on listening, and that without that foundation and support, you might be giving entirely wrong information. So it's been a good collaboration for all of us.
Does anyone have any other questions? If you'd like to share, please feel free to unmute yourself, or we can unmute you, or you can post the question to the chat. And have you, realizing that this has been a collaboration with public libraries, have you also looked at other institutions? I believe you had mentioned you had initially worked with adults, and it was a mental health type.
It was a residential drug treatment.
Okay.
And so there is that mental health. There's always going to be that mental health component in there. And then we worked with, acute crisis center that served both pediatric patients and adult patients. Smaller populations, targeted populations, in which both populations had access to mental health professionals, including social workers. So what we did is we took those two models and then brought them out into the community to see if this would work, if this was something that was useful.
But one thing, to point out too, is it's been interesting because in both of those more restricted environments, as Peter mentioned, they had their own challenges. At both of them, we were sort of establishing the library from the ground up. They had kind of a shelf of books at each, I think, when before we went in, and they ended up looking very different for obvious reasons. The adult side of things, I think they kind of sort of took it on and started the residents started sort of running part of the library. And at the, for obvious reasons, the pediatric patients didn't have that kind of, I think, ownership. The other issue with that, though, is that those patients, residents, are usually only there for about a week. So we were kind of managing, within an entirely different set of unique challenges of like, okay, well, how do you check out books to make sure they come back if we're only there a couple times a week, and we're, trying to work with already overworked nurses and techs there. But we at the psychiatric facility for the pediatric residents, we had actually just started running some group programs once a month in conjunction with the social workers. That all was halted because of COVID. They stopped allowing, for, again, obvious reasons, stopped allowing outside groups into the facility. But we're hoping to get that back up and started again this fall. And actually, a lot of the group sessions that we did for them, we were able to even use some of the models for those sessions at our public libraries for the youth, and vice versa. We're hoping that we can take some of the group sessions that we've run at Temple Terrace and run them kind of in an in-person setting at that facility once we're able to get back in. So I think, again, it's flexible, but there is some overlap, in all of these different populations and organizations.
Actually, Susan mentioned in the chat that she can see this, could see community-based organizations that focus on providing adult literacy services as being possible partners for this type of programming. And actually reaching out to the state library's literacy leadership group might be helpful.
Mm-hmm. Yeah, those are wonderful. Now, we had financial literacy programs and financial literacy resources as part of, I think, the two programs dealing with adult, but it didn't necessarily have to be financial literacy. I think we did in one of the libraries, if I'm correct now, like we did it in conjunction with anxiety, right? And you can't say that finances and anxiety are separate, right? We can't compartmentalize that. And so the idea was, how do you deal with, housing and employment insecurity and not address, anxiety? And if you can address the financial literacy, you can ease some of that anxiety. So again, we're looking at these adjacent issues. They don't have to be right on point, but, community-based, literacy resources and state councils, I mean, those are wonderful. Yeah, they would be wonderful partners.
That's what I was going to say. I mean, I think that it's a great idea. And it really does speak to the fact that these organizations exist and these community support systems are there, but part of the issue is just making sure people know about them, making sure that they see the connection and see how the organizations could help their situation and that kind of stuff, which, kind of goes back to what we were saying before about how, so many organizations and libraries are doing a lot of this work already. It's just, characterizing it as such, characterizing it as mental health support and community support, and, not to get to like weeds administratively about it, but part of this is also justifying what we're doing to funders and to the state. And, if we can frame it in such a way to show the potential and real impacts that libraries are having on people, that's half the battle, I think, for getting continued funding and continued support. So, that's also, we're interested in that advocacy element as well.
Through your sessions, was there, understanding that you had lesson plans and you had ideas of, sort of guides of where you were starting, from the interaction with the participants, did you find that you went down a path that you hadn't necessarily anticipated, that, actually was very beneficial to the group, to the participants to explore.
Yeah, and I think that's one of the important aspects of this is we're talking about the needs of our participants, the needs of this population. So we have an idea. We work in, collaborate with our librarians, but during these sessions, sometimes we'll get through the whole lesson plan. Often we don't. And often, there's these, issues that we cover based on this discourse. Again, because it's discourse based and it's not, prescriptive or, didactic, I shouldn't say, it's not. And so the idea is because it's discourse based, it's going to change. The program is going to change based on that input and that discourse. So
Yeah.
It's designed to be flexible, and we have found that it's flexible depending on not only the library partner, but also the participants also.
Well, and I also think, so this is something, something that, to just, to be totally transparent, at all, some of the libraries, we have not had the attendance numbers that we were hoping to have at every session. That's where I mentioned that we've had to kind of move to asynchronous to some of the audiences because, so I think that was also part of it, is like realizing that the way that we were presenting the information and the means of how we were presenting it needed to change because it wasn't necessarily getting to the audience that we wanted to. Part of that was pandemic related. This was initially written and designed to be an in-person event, and obviously that never happened. But I think we also were able to make, for example, at the youth, the Temple Terrace, we've for several weeks now had youth participants, so people who are signed into the sessions, but that seem uncomfortable about actually participating. And I don't know whether that's an online thing or if that's just a teen thing or just a human thing. But for example, one of the things that we've done, our wonderful GA who is running the sessions right now, a graduate assistant who's running the sessions, Janet, she suggested moving to kind of a poll-based model of interaction. So trying to get people involved by asking very specific questions that they can just type in the chat box. And it, has prompted, I think, discussion, but gives kind of that icebreaker to this particular audience that we needed. So, some of it, while it would have been nice if the conversation sort of meandered in a different direction, but some of it was just like, how do we get the conversation at all? How do we even start that to begin with? And that's been, a learning curve for us. And for, I think, a lot of libraries who have had to move, programming online. So. I know we're getting to the end of our time, but I just wanted to mention again, we are happy to answer questions via email. If anybody has any, we love to talk about this clearly. So please reach out.
Well, and the opportunities to implement it are really open-ended because there are so many ways you could implement this.
Mm-hmm. Yeah, we like to, because we'll have people, emails or talk to us and say, hey, can you send us a book list? We're like, it's really just not book list. We really encourage everyone to do the 3 interventions because you do it already as a librarian. How you do it and how it looks, there's, again, a lot of flexibility built into this framework. But you want to at least have those 3 interventions because each one builds on the other, kind of reinforces it and helps theme it and makes sense of everything.
Thank you all too for the nice comments. People are typing in the chat box. I appreciate that.
Sorry, I wasn't reading those.
No, that's okay.
Like,
no, that's okay. No, read them out, Mary Kate.
Yeah, okay.
No, don't do that. Don't do that.
I was trying, and then it's
oh no.
But it does actually. Susan mentioned that these are ever-changing roles in providing new and relevant services in a library. Great idea for combining. Nardia commented that it's a great idea to combine financial literacy and anxiety.
Yes, Nardia.
And everyone's saying thank you for a great presentation.
Well, we appreciate it. We appreciate you attending.
We really want this. We don't want to own it. We want to steal it. We want to grow. And that's why, again, we're focusing on building this platform for training and ideas. And Natalie's done so much on the administrative. Oh, Lisa. Yes. Has done so much. The hard part is the details, really. I think that's what we found out.
Isn't it always?
Well, and also finding which medium is the best for your targeted group. Because not everyone, some people like online, others would prefer face-to-face once we can all go back.
Yeah,
right.
Right. Real quick, I mean, a related project that is also happening in Vermont using this model, I've been working on that primarily, is that, as a matter of fact, people call in on their cell phones, because they don't know how to, or they don't like to use Zoom and stuff. They'll just call in on their phones. And that's equally as effective. So this whole idea of having this video face-to-face is nice, and we encourage that, but it's not necessary. I mean, if you just, just use speakerphones, you don't necessarily need that platform. It's whatever technology you have, whatever your target population is comfortable using, then use it. Don't try and force them into something that they're not comfortable using. So. And that goes with what Natalie was talking about. A lot of our teens, they'll pop on every once in a while, but they'll just type, I guess, because it's like texting, right? They feel more comfortable texting and typing. Plus, they're super fast too. I can't type that fast, so
it's incredible.
Yeah. So we'd love to hear from anyone if anyone has any requests, ideas, or anything.
Well, thank you, Peter and Natalie, for presenting. This was very informative. The slides, Vicki, the slides will be sent out if they haven't already been, and the link to the recording will be available to all attendees. We appreciate everyone attending. We will be doing a graphic novels session next month. Sorry, I don't have a calendar in front of me. It'll be August 10th, I believe. That'll be Tuesday, August 10th. So again, this would be, please join, and we look forward to learning more about this. And, as you progress, let it keep us in mind, because, we'll be more than happy to have you come back for an additional session throughout the.
Wonderful. Thank you so much again.
Yeah. Thanks,
everyone. Wave goodbye.
Bye.
Take care now.
Everyone have a wonderful day.
You too.
Right? Nice weather. Take care.
Take care.
Bye.